So most of you probably know Tina Turner passed away, and we don't know the cause of death yet, but it has been disclosed she had suffered from a number of health problems over the years, including intestinal cancer, stroke, kidney disease, kidney failure. So I want to read something to you off of showyourkidneyslove.com/en. So I guess this is an England website of something that Tina Turner has said. Is kind of long, so just bear with me. So it starts off by saying hypertension killed Tina Turner's kidneys. It required an organ donation from her husband, Irwin, to save her life. The musician recounts the story of her high blood pressure, dialysis, and kidney transplantation. So the first part is, my kidneys are victims of my elevated blood pressure. I considered high blood pressure my normal. Hence, I didn't really try to control it. In 1985, a doctor gave me a prescription for pills, of which I was supposed to take one a day, and that was it. I didn't give it any more thought. After suffering a stroke in 2009, because of my poorly controlled hypertension, I struggled to get back on my feet. This is when I first learned that my kidneys didn't work that well anymore. Let me pause here and say that is how a lot of people find out that their kidneys aren't working well anymore, when they stop working well. And there's usually signs on lab work before that. This is why there's a disconnect between the doctors who are prescribing antihypertensive meds and them teaching their patients about their kidneys. The minute somebody has high blood pressure, I'm telling them to be aware of their kidney function. And the fact that she didn't know to do that is a problem, I think, in the medical system. Okay, moving on. They had already lost 35% of their function. I tried to learn more about these organs' function and meaning, which is good. 35% is still something to work with. Most people probably don't even know where their kidneys are located. They are in your lower back, one on each side. They look like kidney beans, but they're bigger than that. And what they are for until their health is at stake. And yeah, it's not something that most people talk about until they have a problem with them. Otherwise, they don't think about them at all. You don't feel them or anything like that. But yeah, what I have noticed, and I'm pausing right now to say that people come to me already very low in kidney function. They didn't know what was going on. It was, last minute. The struggle for healing is always also a struggle for accurate information. Ding, ding. I continue to be on prescriptions for controlling my hypertension, but I was convinced that they made me feel even worse. With time, I developed a fatal dislike of these pills. So let me pause here and also say I have gotten people who want to come work with me because they're very anti-medication. And I'm the one who's usually saying, hey, I can help you to naturally reduce the blood pressure, but I still want you to be on the medication in the meantime. We're going to do this gradually, over time. And the most important thing that I want you to do is keep your blood pressure in a normal range. And here is an example of why I say that. I remembered relishing life before I started taking them and wished I could be as clear-headed and energetic as I used to be. So let me first say also, there's multiple medications for blood pressure. Not every single one is going to work for you. So if one doesn't work, go back to the doctor, try another one. But also, through working through natural means, another possibility is that you decrease the dose of a medication. And then those side effects may not be as severe or non-existent to begin with. And I don't know what dose she was on, but I just know from working with clients and just using medications and a lot of other things myself, that is a real thing where you can decrease the dose, you have less of a side effect. But then other people are just anti-medication because theoretically they're anti-medication, right? And that's not to say that those are not valid reasons, but there is a balance with things. Okay, when a friend suggested a different approach and recommended a homeopathic doctor in France, I didn't hesitate. Homeopathy is wonderful. It's something that naturopathic doctors use. But I will have something to say here. He replaced my conventional medicine with homeopathic medicine. Homeopathy is well known in England, where this is from. So it's something that is here in the United States. It's just not as well known, but it's globally known therapy. And I was told to always drink, I guess water. Indeed, I started feeling better after a while. I had not told my doctors about my experiment, and when my next routine checkup was due, I was excited to see if the homeopathic medication had decreased my blood pressure and improved my kidney function. So here's where I think the homeopathic practitioner could have done a little bit better. When I'm working with somebody on blood pressure, I'm having them check their blood pressure every single day at home. I would not have said just wait until you get to your next appointment a month, 2 months, 3 months from now. No, you can check your blood pressure every single day. And you can see how it's changing over time. That's one of the reasons I have my clients record their blood pressure every single day and send it to me, because I want to see, is it trending down? Is it trending up? Is it about the same? Like, what's going on here? All right. Rarely in my life had I been so wrong. I had not known that uncontrolled hypertension would worsen my renal disease and that I would kill my kidneys by giving up on controlling my blood pressure. So she went one way, hoping it would work. Homeopathic medicine is wonderful when it works. Just like anything else. When something works, it's wonderful. But if it doesn't work, and she just completely got off the medication. And that's not the way that I would have done it. And that's not the way I would have taught her to do it. Really in my life had I been so wrong. I had not known that uncontrolled hypertension, yeah, I said that part. And the fact that she says I had not known that uncontrolled hypertension would worsen my renal disease, that's the fault of the doctor. They should have been telling her that the whole time. Clearly she had hypertension for a long time and nobody told her. And this is the problem that I see here in the United States. And clearly it's a problem globally. I never would have replaced my medication by the homeopathic alternatives if I had an idea of how much was at stake for me. This is why when I say what's at stake, and you'll see more of what I say when at stake. This is why I do more of a, over time, let's see if we can get you off the medication, not me get off, but to the point that what I usually like to see is there's drops in the blood pressure. Usually when people come to me with high blood pressure, it's still high on their medication. I'm looking to see if it's trending downward. And then if it's starting to get too low, or it's like really, really normal, like right in around the normal range, that may be a time where I'm like, okay, maybe you can start talking to your doctor now about the dose of the medication you're on. Do you still need to be on it? Things like that. That's how I do it, not just boom, boom, one or the other. It doesn't have to work like that. It can, but this is a story of where it doesn't always go so well. Sometimes it can, right? Sometimes it doesn't. Thanks to my naivety, I had ended up at the point where it was about life or death. At first, I may not have noticed any signs of sickness, but some of the symptoms that I blamed on the medication, like my fatigue, nausea, or occasional irritability, were really signs of my kidney disease in its final stage. So that's stage 5, also considered renal failure. How could it occur to me to make treatment decisions all by myself? Which she shouldn't have not come. When you come to a doctor, you're shopping around for doctors. Yeah, you got to make some choices for yourself, but in this situation, there was more teaching that could have been done on both sides, medical and alternative medicine. If I had had any idea about the risk I was taking, I would have never taken any chance in alternative medicine. I disagree with that. I just think it wasn't done as well as it could have been. And thus now she had a not so great view about it. The doctors made it very clear that the consequences of my decision were irreversible. Not necessarily. My kidney function had reached its all-time low. Most people probably don't even know where the that's just repeating. Most people don't even know where their kidneys are located. In order to survive, I had to start dialysis. And you guys know that you probably see dialysis almost like every 5-10 minutes when you drive. It was my only option, but it was depressing to be connected to a machine for hours. And I get a lot of calls saying, hey, I'm trying to avoid dialysis. Even though there's other options now, you don't necessarily have to be going someplace and multiple times a week for hours. You can do it at home. There's different options now, but it's still something that people tend to try to avoid, at least the ones that are coming to talk to me. For the next 9 months, all my life was about dialysis. I realized that the struggle for healing is also a struggle for accurate information. For example, I had not been aware that chronic kidney failure is called silent killer, just like high blood pressure can be, because symptoms do not become noticeable until 80% of renal tissue is lost. This is why I'm telling my clients to be looking at their kidney function often, and I teach them what to look at. As it happened to me, hypertension is one of the most frequent causes of kidney failure. Yes, it is. High blood pressure, diabetes and hypertension are the top 2 reasons in the United States for kidney disease. And this is why I've become an advocate for, I chose the market of people with high blood pressure to teach them about this, because they don't know. I was lucky that Erwin, her husband, offered to donate one of his kidneys to me. It was the first step to kidney transplantation, a very complex procedure. The months after the transplantation were marked by a never-ending up and down. From time to time, my body tried to reject the donor kidney, as it frequently happens after a transplantation. Every so often, this required more hospital admissions. I kept feeling nauseous and dizzy, forgot things, and was scared a lot. I should also mention here that kidney disease can cause dementia, but this could have been something different, but I just figured I'd say it at this point. These problems are still not quite resolved. This is when she was still alive. She apparently wrote this. I am on multiple prescriptions and take great care to follow my doctor's orders meticulously, for I know that I can trust them and their therapies. So this is just an example of why I say the things that I've said when it comes to high blood pressure, when it comes to kidney function.